past were so gallantly streaming, and the rocket's red glare, the bombs bursting in air, gave proof through the night that our flag was still there. Oh, say does that star-spangled banner yet wave o'er the land of the free and the home of the brave?
Hoist the colors. Please be seated, and thank you to the United States Navy Color Guard and Chief Sigmund for that wonderful rendition of the national anthem. We are so grateful for your presence here today and hope that you enjoy the program that we have in store for you for the next 2.5 days. A special thank you to EOUSA for their tremendous support in putting this summit together. I would also note that your agendas that you should have found on your seats show that the Attorney General will be speaking with you this morning. While this issue is a high priority for the Attorney General, he is unfortunately unavailable this morning, but he is scheduled to speak with you ahead of the Friday's headline speaker and is very much looking forward to addressing you then. The fight against the opioid crisis is one of the highest priorities of the Department of Justice and the entire administration. Our department-wide efforts are in fact key elements of our broader strategy for combating not only this crisis, but the threat posed by transnational organized crime. Our leadership measures our performance by whether we help bring the death toll down. Our Attorney General and Deputy Attorney General have set the tone, and it's inspiring to witness the hard work and dedication of our employees across the Department of Justice. Today, we're here to discuss our efforts to stem this epidemic through reducing the supply as well as the demand. This summit brings together United States attorneys, federal, state, and local officials, government and public health officials, policy leaders, and most importantly, families who have lost their loved ones to this vicious epidemic. Throughout this summit, we will have the opportunity to reflect on the obstacles we've overcome, on the new ground we're breaking every day, and on the challenges that still lie ahead as we work together to combat this crisis. At this time, it's my honor to introduce Deputy Attorney General Jeffrey Rosen. He has spent 30 years as a litigator in private practice, handling cases all across the country. He is magna cum laude graduate from Harvard Law School, and for several years was an adjunct professor at Georgetown University Law Center, where he taught professional responsibility. Previously, he served in a prior administration as general counsel of 2 different federal cabinet agencies, the Department of Transportation and OMB. He has also served the last 3 years as the number 2 official at 2 different cabinet departments, first as Deputy Secretary at the Department of Transportation, and now as Deputy Attorney General here at the Department of Justice. Ladies and gentlemen, please join me in welcoming Deputy Attorney General Jeffrey Rosen.
Thank you, Amanda, for the nice introduction. Good morning. It's so wonderful to see so many friends and colleagues here. I want to thank everybody from coming from all over the country to attend this important summit. That so many of you have taken the time to be here is a testament to the gravity of our subject. I'm honored to be here speaking with you as we discuss the Department of Justice's efforts to address our nation's opioids crisis. Since the year 2000, more than 400,000 people have lost their lives due to opioids. This staggering number of deaths has pushed drug overdoses to the top of the list of the leading causes of death for Americans under the age of 50 years old, and it's caused a decline of 2.5 months from U.S. life expectancy. According to the Centers for Disease Control and Prevention, more than 67,000 Americans died from drug overdoses in the year 2018 alone, and more than 2/3 of those were caused by heroin, fentanyl, and prescription opioids. Now, thanks to the leadership of President Trump, in March of 2018, the administration released the Initiative to Stop Opioid Abuse and Reduce Drug Supply and Demand, and since then, the number of fatalities has declined last year for the first time in more than 25 years. However, I think everyone in this room knows we still have a lot of work to do. Our department has no higher priority than keeping the American people safe. So addressing this issue is at the top of our agenda. The Attorney General reminds us of it often, and it is one of those issues that's always on our radar. The other aspect that I'd note right from the outset is this is truly a department-wide effort with everyone from the DEA, FBI, and our U.S. attorneys taking part, and throughout the department, and of course colleagues elsewhere in the government. I'm grateful for the work all of you do every day in this area. You're all on the front lines working to defeat what seems like just an endless stream of drug traffickers and some really disgraceful doctors who intentionally overprescribe for profit. We would not be able to fight this fight without our U.S. attorneys and our opioids coordinators in every district. Your work with national, state, and local law enforcement is just so important and so valuable. Your tireless devotion is one of the many reasons that the administration has made the progress we have in combating this issue. This overall effort has been successful in implementing the initiatives on opioids to date, and we are seeing success. One such initiative is focused on dismantling darknet websites that allow some of the most prolific drug suppliers to peddle their poisons. In 2018, or beginning in 2018, the FBI established the Joint Criminal Opioid and Darknet Enforcement Team, also known as J-Code. Since J-Code's launch, there have been 2 successful, very large-scale busts that have taken hundreds of kilograms of drugs off the streets and dozens of darknet accounts offline. These darknet investigations will be further discussed during the summit. Another really important and noteworthy department initiative is Operation Synthetic Opioid Surge, or SOS, which focuses on illicit opioids in 10 districts with some of the highest opioids overdose death rates in the country. Our goal in those districts is prosecuting all readily provable cases involving synthetic opioids and to identify wholesale distribution methods. In the first year of the program, over 300 cases were charged in just these 10 districts, with many of the cases focusing on cases where the dealers were prosecuted for selling fentanyl that had resulted in an overdose death. We've seen many of the SOS districts charging the death-resulting cases where a drug dealer is held accountable for a fatal overdose. And indeed, there will be a presentation about this later in the summit as well. In addition, as another important initiative, the department has created the Appalachian Regional Prescription Opioid Strike Force, or the affectionate nickname ARPO, which is a joint law enforcement effort that pools the resources and expertise of multiple agencies to identify, investigate, and prosecute healthcare fraud schemes in the Appalachian region, which of course is one of the areas hardest hit by the opioid epidemic. Since its establishment in 2018, ARPO has charged more than 70 defendants across more than a dozen districts who are collectively responsible for distributing more than 40 million pills. These defendants were often medical professionals who were charged with Title 21 offenses, which carry very stiff penalties. So as you will hear during the summit, the ARPO Strike Force has also worked in partnership with HHS to ensure that when there is a takedown of dishonest medical professionals, patients are met by a team of public health officials who can refer them to legitimate medical providers or, if appropriate, addiction recovery services. Another approach to stop the illegal flow of prescription opioids The department's Consumer Protection Branch in the Civil Division has dusted off a statutory provision that had been virtually unused as the crisis was worsening over the last decade, and the department has sought civil injunctions under the Controlled Substances Act to stop the unlawful prescribing and dispensing of controlled substances. For example, when DEA data showed that 2 pharmacies in a small Tennessee town were dispensing enough opioids to supply a mid-sized city, we successfully enjoined the 2 pharmacies, their majority owner, and 3 pharmacists from continuing to dispense controlled substances. The complaint also sought monetary penalties and then was followed by a criminal action against one of the pharmacists. Unless wrongdoers get the message and stop this kind of activity, you can look for DOJ to bring many similar actions in the coming year. Now, due in part to the tremendous efforts by the Department of Justice and by our components and our colleagues at DEA, at FBI, DHS, USPIS, HHS, and others, we're starting to see some key results. For the second year in a row, there has been a decline in overdose deaths in the United States. Though the decline is modest, it is remarkable considering that we have historically seen, since 1990, a steady increase in overdose deaths. So reversing that deadly trend is a very important mark of progress. In addition, the DEA has also reduced by nearly 50% the aggregate production quota for 7 of the most frequently diverted controlled substance opioids since 2016. The number of prescriptions for those 7 opioids has decreased by more than 33% since 2017. This is a welcome relief after a steady increase in the overall national opioid prescribing rate that had started increasing in 2006. As another mark of progress, DEA's seizures of fentanyl have increased since 2016 by over 700%, a 7-fold increase. The department's prosecution of opioid-related offenses has reached record levels with more than 11,000 opioid prosecutions in the last fiscal year alone. And as you will hear today and during the summit, there will be no let-up in our efforts to combat this plague. Our successes, however, do not stop with these critical efforts that all of you have made in implementing the department's enforcement initiatives. Indeed, perhaps one of the administration's most imperative steps was the President's recent signing of the Temporary Reauthorization and Study of the Emergency Scheduling of Fentanyl Analogs Act. That's a mouthful. But what it does is it provides a 15-month extension of DEA's scheduling order of all fentanyl-like substances on a class-wide basis. And I don't need to tell all of you how important that legislation is. After all, an important part of what made it happen is that many of you engaged in education, in outreach efforts, wrote op-eds, issued statements, gave interviews, and explained the need for not only a temporary extension, but of permanent legislation to ban fentanyl analogs. The department's goal, of course, is to enforce our drug laws and keep these poisons off our streets. But ultimately, we are striving to keep more of our fellow Americans alive. We can't do that if the deadliest drugs fall outside of our laws. Now, while not every district has experienced the full wrath of fentanyl and its analogs, far too many districts have been inundated with these drugs, some of which can be up to 10,000 times more potent than morphine. So I want to personally thank all of you who contribute every day to the department's greater causes, regardless of whether your district is experiencing the same challenge as your neighbors, or if you are one of the ones who have other challenges but support the department's overall efforts. Either way, you are an important contributor to what we're trying to accomplish. And your support is critical to all of the department's achievements, but for example, and in particular, obtaining the 15-month extension of the legislation to ban the fentanyl analogs. And I have no doubt we will see another united effort when the time comes to again address legislation calling for a permanent ban. So, as federal prosecutors, those of you here who are federal prosecutors, let me say, you are the best in your field, and your number of successful prosecutions speaks for themselves. And as if that wasn't enough, in addition to the successful prosecutions, many of you are tackling the crisis outside the courtroom as well. You work to better inform the public about the dangers of opioids. You speak on panels, you speak to school children, you speak to vulnerable populations about the dangers of opioids. In your offices, your law enforcement coordinators are working regularly with your local and state partners to ensure that your federal resources are doing the most that they can to help the populations that we all serve. Your victim witness staff work with individuals who are the most impacted by this epidemic. You are all part of a community that is making a difference in people's lives every day. You help to protect the public, you help to stop the promoters of poison, you help to preserve lives that might be lost. So as we get this summit underway today, while we all know that there is much more to be done, I want to thank you, and the entire department owes you its thanks, for your unwavering devotion to doing all that we can to end this terrible opioids affliction. Our work continues. Thanks to all of you.
Thank you again to Deputy Attorney General Rosen. We really appreciate your comments today. He is obviously very busy and so will be departing us at this point, but he will be back on Friday to join us. We are going to take a brief pause here so that we can set up for our first panel, and we will start that panel at 9 o'clock, so don't go too far. Thank you.